Heart valve replacement surgery involves removing a damaged or diseased heart valve and replacing it with a new one, either mechanical or biological. The procedure is typically done under general anesthesia, with the heart often stopped and a heart-lung bypass machine used during the surgery. After surgery, patients may experience a range of recovery times, often requiring a cardiac rehabilitation program. Detailed explanation. 1. What is heart valve replacement? Heart valves control the flow of blood through the heart chambers and into the aorta and pulmonary arteries. Heart valve replacement surgery is performed when a valve is too damaged to be repaired and needs to be replaced with a new one. The replacement valve can be either mechanical, made of man-made materials like titanium, or biological, made from human or animal tissue. 2. Types of heart valve replacement. Mechanical valves. These valves are durable and long-lasting, but require lifelong blood-thinning medication, like warfarin, to prevent blood clots. Biological valves. These valves may require replacement after 10 to 15 years, but don't typically require lifelong blood-thinning medication. 3. The surgical procedure. Open heart surgery. This involves making a large incision in the chest, sternum, to access the heart and perform the valve replacement. Minimally invasive surgery. This approach uses smaller incisions and may involve less recovery time. Transcatheter aortic valve replacement, TAVR. This minimally invasive procedure involves inserting a new valve into the existing aortic valve through a catheter. 4. Recovery and aftercare. Hospital stay. Patients typically stay in the intensive care unit, ICU, initially, then move to a regular room. Recovery. Recovery time can vary, but it's common to require a cardiac rehabilitation program to help regain strength and endurance. Follow-up care. Patients will need regular follow-up appointments with their doctor to monitor the new valve and ensure proper function.